And welcome back. It's time for Morning Round. Some patients with cancer have weakened immune systems due to their underlying condition or even treatments.
And having a weakened immune system makes it harder to fight off illnesses such as COVID-19. Radiation oncologist Dr. Stephen Demore with Christie Clinic joins us now over video chat to talk a little bit about that. Good morning, doctor. How you doing?
Good morning. Thanks for having me.
Thanks for being here. So first and foremost, how is COVID-19 affecting cancer patients?
Well, cancer patients are more susceptible to effects from COVID-19 for a couple reasons. Number one, they tend to be older, and so that puts them at a higher risk for adverse effects from COVID-19. The other is that either because of their underlying cancer diagnosis or the treatment that they're receiving for their cancer, their immune system can be weakened. It can make it harder for them to fight off COVID-19 if they're exposed.
And can you tell us, should patients continue their treatments if they do have cancer?
Yeah, so for patients who do not have an active COVID-19 infection, who are either being evaluated for a cancer diagnosis or who actually have a cancer diagnosis, we currently recommend that they proceed, so that they proceed with their evaluations, or if they are under treatment, that they proceed with getting their treatment. Now, there are exceptions to that, but as a general rule, based on the circumstances we're in right now, those are the current recommendations.
So, of course, everyone is worried about contracting COVID-19, but are cancer patients actually at a higher risk?
Cancer patients are at a higher risk, certainly for getting sick from COVID-19, and that is because their immune systems are sometimes weakened by their diagnosis or their treatment, and so they have a harder time fighting it off, and so they are exposed to it. They're more likely to get it. And if they do get symptoms, they are more likely to have severe symptoms than patients who don't have cancer.
And what recommendations would you have to help those cancer patients minimizing the exposure to COVID-19?
Yeah, so a lot has changed in the management of cancer patients in an attempt to try to keep them safe, knowing that they are a high-risk population. So we're minimizing their exposure as they come into medical facilities to get their treatment. We're minimizing the number of visits that they have, and so we're adopting strategies such as video visits or phone visits for patients who don't need an examination that day, but they need to interface with a physician. In the radiation oncology field, we have found that we can achieve similar outcomes with fewer treatments in certain circumstances, and so we've adopted a regimen with fewer treatments than we have in the past in certain cancer diagnoses. We've changed procedures within our clinics drastically, and this is true for any patient who's pretty much gone to any medical appointment recently, they've noticed. And certainly in our department, we're very careful, and so now we pre-screen all of our patients. We do everything we can to avoid any contact between patients. So we no longer have an open waiting room. We now use the parking lot as a waiting room, so patients will pull up and they call us or we call them, and once the previous patient has left, then we give them the okay to come in. When they come into the department, they of course are screened, they have their temperature taken, they have a mask on. We minimize the number of visitors that they can have with them, typically to one. All the staff, of course, is wearing protective equipment. When the patients come in to receive their daily radiation treatment, they sanitize their hands. The equipment that they are treated on immediately gets sanitized before the next patient is treated. The other thing that we are really focusing on is patient education. We're letting these patients know that they are in a high-risk situation and really stressing social distancing for them. And then lastly, if they do have any symptoms of COVID-19, we're very proactive in getting them tested.
Are you doing any other things like temperature checks and things of that nature? I know a lot of people and a lot of clinics are doing that as well.
Yeah, absolutely. They get their temperature checked before they enter any part of Christie Clinic, and Carl, I'm sure, is doing the same thing. And certainly before any patient comes into our department, they have their temperature checked and they have to get pre-screened with a symptom questionnaire.
And are you seeing more virtual appointments for a lot of cancer patients to help avoid the spread right now?
Sure. And to some degree, the degree of precautions that we take is based upon the level of infection in the community. But certainly, we have switched over to video visits and phone visits in patients who are really susceptible and who don't absolutely have to have a physical examination that day for their appointment.
A lot of precautions being taken by Christie Clinic, of course. I'm sure this makes people feel a little bit more at ease, but I would also think that having an open conversation with your doctor is extremely important as well, right?
Oh, for sure. Everybody's situation is a little bit unique. And so, what we discussed about here are generalities that apply to most patients, but certainly there are circumstances in which a more deep discussion and a deeper examination of exactly their situation to help decide what the best thing for them is to do is needed.
And what are some of the most common questions that you're hearing from a lot of those cancer patients right now during the COVID-19 pandemic?
Initially, of course, patients were very worried about coming in for any type of treatment or appointment, and we still get a lot of questions about that, and we still have patients who would rather avoid coming in, for example, for follow-up visits or that kind of thing. And they're more nervous than anything else, and we really need to provide reassurance that everything that can be done is being done to keep them safe, and that social distancing is very effective, and that they should continue treatment, because for most of these patients, and certainly in this area, their cancer is still the biggest risk for their health.
Of course, and I hope this conversation this morning has helped them feel a little bit better as well.
I hope so.
Thanks, doctor, for your time this morning. We appreciate it.
Hey, thank you.